Professor Derick Raal, and I'm head of the Lipid Clinic at the Johannesburg Hospital. I'm just going to be discussing some issues related to cholesterol. The misunderstanding about cholesterol is everyone thinks it's bad, but we have to remember that cholesterol is an essential part of the human body. We use cholesterol for the production of hormones, bile salts, etc. So it's an essential building block of the human body. It's very much like petrol for your motor car. One of the problems is when you have cholesterol in excess. So when there's too much cholesterol, that deposits in the arteries, narrowing the arteries, which can result in heart attack or stroke, which are now the biggest killers throughout the world. Cholesterol is transported in a protein called LDL, or low density lipoprotein. So when there is too much LDL cholesterol, that would deposit in the arteries, causing this condition called atherosclerosis. LDL cholesterol is the main carrier protein for cholesterol in the blood, and we all need a certain amount. But when the LDL cholesterol level is high, this will result in deposition of cholesterol within the artery walls. By far the commonest cause of a high LDL cholesterol is poor diet, so eating excessive fat, for example, saturated fat in the diet. And so you can correct, in many people, you can correct the LDL by eating healthily, eating correctly. However, there are many people who have a very high LDL cholesterol from an inherited condition, which we call familial hypercholesterolemia. So usually if you're found to have a high cholesterol and LDL cholesterol level, and you've tried diet and you have not responded to diet, you may require a medication to lower the LDL cholesterol level. Now, by far the best drugs for lowering LDL cholesterol are drugs called the statins, and these are really the aspirins of the century. There are now over 60 million people in the world on statin therapy. They're remarkable drugs and have really reduced the number of heart attacks and stroke around the world. So people that have high LDL cholesterols and are put onto these medications in the long term benefit from these medications. They're remarkably safe and are indicated in anybody who's had a heart attack or a stroke. They're also necessary for patients who have got diabetes and anybody who's at really high risk for heart attack or stroke.